The reason we don't have transparent pricing is because consumers not only don't shop for their own healthcare services, they don't shop for their own insurance plans. Economists often talk about the third-party payer system and how that's inefficient. That is to say, kind of like I was talking about with the open bar. You don't pay directly for your insurance, and as a result, you're insulated from a lot of the costs of the services that you consume and provide. But not only are you insulated from the costs that way, because we don't shop for our own insurance plans. We don't have third-party healthcare. We have ninth-party healthcare in America. And that's why it's so expensive. And so the only way to change, there's two ways to change that. One, you can legislate price of transparency, something that the American Hospital Association furiously opposes. The other thing you can do is restore the incentives that people have to control their own healthcare dollars. The more you're shopping for your own coverage, the more you're paying for your own healthcare through things like health savings accounts, you can do more to thereby demand health transparency. Where you have it, there are certain people who are offering transparency, and guess what? Their prices are a lot lower than the regional hospitals that they're competing with.
Avik, isn't it the case that everybody who's going to be shopping for insurance on health insurance exchanges will be shopping with prices transparent to them?
Absolutely, and one of the few good things about the Affordable Care Act is that the exchanges do allow for shopping. The problem is that the plans offered on the exchanges are extremely expensive. So shopping on exchanges, good. Making the plans excessively costly because of all the regulations that are larded onto the plans, bad.
Well, again, the expense of the plans doesn't affect 80 to 85% of the people who are buying them, because above a certain cost per month for the typical plan, the taxpayer picks up the tab. But I will caution you that the exchanges aren't quite as transparent as people think. It is still impossible in many states, if you go on the exchange, to know, for example, what doctors or hospitals are in your network. Now, if you can really hunt around the internet, you might be able to find that. It's still harder to know which prescription drugs are covered by the plan. I have yet to meet anyone, and I'd venture to say even the 5 people who are up here, who could go to any insurance exchange, any of the state exchanges or the federal exchange, and buy a policy with a complete understanding, including the 2 men here, with a complete understanding of exactly what they're buying and how the math works out.
I just want to say I disagree with Steve on the point that the high cost of the premiums doesn't matter because 85% of the people are insulated from them. All the surveys
Well, it doesn't matter to
all the surveys show that
taxpayers.
Even among subsidized people, the high cost is a huge problem because not everyone gets a large subsidy. And all the surveys show, like the one I cited in my opening remarks, that a lot of people aren't choosing the plans because they think they're too expensive.
So just briefly on the question of hospital price transparency.
You keep saying briefly to me. The problem with the price transparency is most normal human beings are interested, if they have diabetes, to know if they go to system A, do they have a better chance of staying healthy than if they go to system B. And what you end up with, looking at all of the pricing transparency in the HIE right now, is a whole series of little things that may or may not relate to your ultimate outcome. Now, one of the things that that we got a lot of celebrity for was having a single price for an episode of care, like heart surgery or like hip replacement, and we took responsibility for complication treatment, free. It was built into the price. Now, that's something that people can understand. It took us 8 years to get Walmart to actually negotiate with us as a center of excellence for that. So all of these changes are occurring, but it just takes a long time because of the stakeholders, because of the understanding, what have you. So to talk about price transparency, but to stay in this fee-for-service compartmentalization, it's very difficult.